Conventional medicine versus functional medicine. When most people think about healthcare, they picture a familiar scene: a waiting room, a brief consultation, a diagnosis, and a prescription. This is the world of conventional medicine, the dominant healthcare model across much of the globe. But in recent years, a growing number of patients and practitioners are turning to a different approach called functional medicine, one that asks deeper questions and seeks longer-lasting answers. So what exactly separates these two systems, and why does it matter for your health? Conventional medicine, also referred to as allopathic or Western medicine, is the foundation of modern healthcare as we know it. It is built on decades of rigorous scientific research, randomized controlled trials, and standardized clinical guidelines. When a patient presents with symptoms, the conventional approach focuses on identifying a specific diagnosis and then targeting that condition with proven treatments, most commonly through pharmaceutical drugs, surgery, or other medical procedures. This model has produced extraordinary results. It has virtually eliminated diseases that once devastated entire populations, dramatically improved survival rates for cancer, heart disease, and trauma, and created life-saving technologies that are nothing short of miraculous. In emergencies and acute situations, conventional medicine is irreplaceable. However, conventional medicine has limitations that become most visible when dealing with chronic, complex, or lifestyle-related conditions. The average doctor's appointment lasts between 10 and 15 minutes, barely enough time to scratch the surface of a patient's full health picture. The system is largely designed to treat symptoms rather than investigate underlying causes. A patient with fatigue, for example, might receive a prescription to manage their energy levels, but the question of why they are exhausted in the first place may never be fully explored. For millions of people living with conditions like autoimmune disease, hormonal imbalances, chronic digestive issues, anxiety, or unexplained pain, this gap in care can be deeply frustrating. This is where functional medicine enters the picture. Functional medicine is a patient-centered, science-based approach that focuses on identifying and addressing the root causes of disease rather than simply managing its symptoms. It views the body not as a collection of separate organs, each belonging to a different specialist, but as a deeply interconnected biological system. A problem in one area almost always has ripple effects throughout the whole body, and functional medicine practitioners are trained to trace those connections. The initial consultation in a functional medicine setting can last anywhere from 1 to 2 hours. Practitioners take an exhaustive health history, examining everything from a patient's genetics and early childhood health to their current diet, sleep habits, stress levels, relationships, environmental exposures, and emotional well-being. They use advanced laboratory testing that goes far beyond standard blood work, looking at markers for inflammation, gut microbiome health, nutrient deficiencies, hormonal function, and mitochondrial efficiency. The goal is to build a complete picture of what is driving the patient's illness, and then address those drivers through a personalized combination of nutritional therapy, lifestyle modifications, targeted supplementation, stress management, and when necessary, medication. One of the most powerful concepts in functional medicine is the idea that chronic disease rarely has a single cause. Instead, it is usually the result of multiple overlapping factors that have accumulated over time. Poor diet, chronic stress, inadequate sleep, environmental toxins, gut dysbiosis, and genetic predispositions can all interact in ways that gradually undermine the body's ability to function. Functional medicine maps out these interactions and intervenes at multiple points simultaneously, rather than treating each symptom in isolation. It is important to be clear, this is not a competition between two opposing camps. Conventional medicine and functional medicine are not enemies. They are complementary systems that each bring unique strengths to the table. No one should abandon their cardiologist in favor of a wellness protocol if they are at risk for a heart attack. No one should skip cancer screening because they are eating a clean diet. The life-saving power of modern medicine is real and should never be dismissed. What functional medicine offers is a layer of care that sits beneath and alongside conventional treatment. One that asks not just, how do we treat this disease, but how do we help this person truly thrive? Increasingly, the most progressive healthcare providers in the world are recognizing the value of integrating both approaches, This emerging model, often called integrative medicine, combines the diagnostic precision and intervention power of conventional medicine with the holistic, personalized root cause philosophy of functional medicine. Patients who benefit most from this combined approach are often those who have spent years bouncing between specialists, collecting diagnoses, and accumulating prescriptions, without ever feeling genuinely well. Understanding the difference between these two approaches empowers you as a patient. It helps you ask better questions, seek more comprehensive care, and take a more active role in your own health journey. Whether you are dealing with a chronic condition that has resisted standard treatment, or simply want to move beyond surviving and start truly thriving, knowing what functional medicine offers can open doors you may not have known existed. Healthcare is not one size fits all. The human body is extraordinarily complex, and the path to lasting health looks different for every individual. By understanding both conventional and functional medicine, their strengths, their limitations, and the powerful possibilities that emerge when they work together, you give yourself the best possible foundation for a healthier, more vibrant life.